era of healthcare reform. And I have to tell you, I couldn't be more proud of the way each and every one of you and your health centers are stepping up and assuming your rightful place, and that is leading the way. Your role in all this work and everything from outreach, education, enrollment, and ultimately providing high-quality healthcare services to millions of patients in California will have a hugely significant impact on the success of healthcare reform in the state of California. And as you know, the nation is watching. What we do here will serve as the model for the entire country. And I truly believe you are ready. And we are in a societal tidal wave of change. I mean, this Affordable Care Act, so incredible, will forever alter the way our country views healthcare education, prevention, treatment, access, and community clinics and health centers. Community health centers are in the perfect place at the perfect time. You're the anchors for healthcare delivery in your neighborhoods, throughout the state, throughout the country. That's the role of health centers. And we take pride in knowing that you're a critical piece of this new healthcare delivery model with the focus on primary care, meeting the needs of millions of newly insured Californians. And it's about not only providing them with the assistance in getting enrolled, which is incredible what you're going to do there, but it's about providing them with that medical home. And ultimately, we are going to be that one-stop shop for the enrollment, the assistance, and the health care. That's a very important role that we're going to play. And we have so long awaited for healthcare reform to become a reality. How many of us have committed our lives to healthcare and the dream of healthcare reform? And this is truly a time to celebrate the tremendous achievement of the Affordable Care Act. It's really a moment of historical proportion, and one that we have been preparing for, and we really need to gear up and manage the way in 2014. Now, we all know that healthcare reform has brought about change that is impacting the healthcare environment and will for years to come. It's a challenging time for health centers and our patients. With all this pressure, there's a lot of financial pressure. There's a lot of pressure with all the operational changes that you're making. The payer mix still isn't right yet. We haven't received the benefit of our population becoming insured. Certainly, it's a challenging time, but it's also creating a number of tremendous opportunities. Now, our community health centers are transforming the way they provide care to their patients. I'm so pleased to see that every health center I visit has implemented an electronic health record, making your practices more efficient and effective. How many of you have implemented or are in the process of implementing an EHR? Please raise your hand if you're in a health center that is in that process. Throughout the room, as you can see, what a tremendous success, especially considering that there are other providers who still have not been able to do that. And we are so pleased to be a partner with CalHIPSO in providing you technical assistance and resources to make this happen. And we continue to urge you, we know it's challenging, but continuing down that path of the EHR is so critical to your transformation and your success. Many of you have also been recognized or are in the process of being recognized by NCQA as a patient-centered health home. And so far, every health center that has applied for recognition through NCQA in California has actually received recognition at some level. And this is really amazing accomplishment. And I want to take a moment to recognize all you health centers that are in the process of NCQA recognition or have achieved it. Please stand if you are taking on that mantle of the health home and leading the way in the health home arena. Congratulations. That is so important because patient-centered care is what community clinics and health centers were built on. And this recognition is one way that we are moving to become providers of choice for the millions of newly insured. Now, we recently entered into a strategic alliance with the Joint Commission to encourage our members to seek ambulatory care accreditation, because we view accreditation as an important vehicle to strengthen your operations and ultimately improve patient care. You can see more about the Joint Commission in our exhibit. Please visit their booth and learn more about this very exciting initiative. And CPCA continues to help our members lead the way in this new arena and make it easier for them to concentrate on the healthcare of their patients. We've developed strategic partnerships with leaders in the field to provide our members with expertise and access to new products and programs to help you to continue to thrive in this ever-changing landscape. So one way we are doing this to assist you in leading the way is the incredible work we are doing with John Snow Incorporated and our health centers in the area of payment reform. First of all, I want to thank those health centers that are stepped up and volunteered to be pilots in our payment reform efforts. Can we please stand and acknowledge those health centers, La Clínica de la Raza, Lifelong Healthcare, those health centers that have agreed to be pilots in our payment reform work. There are a good number, 35 sites throughout the state, that includes public hospitals, that have agreed, again, to lead the way and be pilots in the arena of payment reform. And these health centers are working with the Primary Care Association, along with the California Association of Public Hospitals, to prepare for a future that allows our community clinics and health centers to care for socially acute patient population in a high quality and cost-effective way, and to provide our health centers with flexibility in how they provide that health care. I'd like to thank the local health plans and the county organized health systems that have stepped up and are looking at this initiative and helping us to work to make this payment methodology become a reality. And certainly the California Association of Public Hospitals, who's a great partner, and the California Department of Healthcare Services. Together, we are working on the building blocks for a sustainable payment methodology, which we will test through pilot programs, and ultimately we will expect to show an improvement in patient outcomes and lower total cost of care. This is going to transform not only healthcare delivery, but it's going to show an even greater value to the overall healthcare system. We're also working to help the Primary Care Association become a greater value to you. One way we are doing this is through expanded member services to help each of you increase your operational capacity, which we know is going to be so critical in this healthcare reform environment. And I am very excited to announce today that we have developed a new and exciting partnership with Priority Management Group, or PMG, to provide revenue cycle management services to our members. This new service is aimed at helping each of you increase your revenue from third-party payers and allow you to focus on delivering high-quality care to the uninsured and underserved of California. This member service is aimed at helping to enhance your business and help you to focus on what's important, your patients. So again, I encourage you in the expo to look for the PMG and CPCA partnership focusing on revenue cycle management. You know, all the time we spend working with the department to collect after the fact on billing and those kind of issues, we can take care of them at the front end with revenue cycle management. We encourage you to join into this effort. Another exciting partnership is with the Kylie Group and the development of our Health Management Plus program. This is a leadership program developed specifically for health center staff. And we're so proud to have the first cohort of students completing the program this year. And these graduates, they really are our future. These are folks who work in the health centers who aspire to leadership positions, who are investing the time and effort in their own development so that they can become greater leaders for the health centers. We are very proud of all of them. And I'm happy to say we are currently accepting applications for the next cohort of students in Health Management Plus. So I highly encourage all of you to learn more about this program and get your staff enrolled before the November 1st deadline. Now, some of our most important work has revolved around positioning community clinics and health centers in the new healthcare marketplace. And we are doing this in a very exciting way. And that is with our branding initiative. And last year, you might have recalled, I talked about the fact that we were working on the development of a brand for community health centers in California. And I'm so pleased to come back to you at this point to tell you that we have landed on that brand. It is out there, and it is California Health Plus. California Health Plus. California Health Plus truly is our future. This branding work pulls together your mission to improve upon the health and quality of lives for individuals throughout the state, and in turn, ultimately improve community health, education outcomes, economic stability. We know that California Health Plus centers are the backbone of healthy communities and of a healthy California. And soon, 5 million people are going to be eligible for health care insurance. And California Health Plus centers are going to stand ready to help enroll them and ultimately provide services to the community. You're going to help individuals navigate this complicated insurance enrollment process and encourage them to maintain a regular regime of preventive health care services. You're going to encourage the newly insured to take an active role in maintaining their own health, which is good for the patient and good for the overall health of the community. So California Health Plus centers, we're really positioning you in the marketplace as that provider of choice, and that was always the vision. And what is that plus in California Health Plus? Well, that's what you do. You're not just a regular healthcare provider. You go above and beyond. Where else can you get prenatal care and immunizations and dental care and mental health and even some specialty care all under one roof? That is the plus of community health centers in California and of California Health Plus. And that's what we need to educate the broader public around. And we're so pleased that through a partnership with the California Endowment, we were able to develop California Health Plus public service announcements in English and Spanish. These are our own commercials. That was our dream, that California Health Plus would actually be able to be on TV and be in commercials advertising this. And actually, due to the generous support of the California Endowment, that dream has become a reality. Our PSA ran on Univision during National Health Center Week, reaching more than 10 million viewers. You can check out our PSA in the Media Gallery, located in the East Lobby of the Convention Center. I really encourage you to stop by the CPCA booth and look at the great work that we put together under California Health Plus. And you know, this PSA is going to be running later this month. So if you haven't signed up as a California Health Plus center, you need to do so. And we have ways to make it easy for you. It's called rapid recognition. And we call it rapid because you can do it fast, you can do it easy, and you can do it online. And you can become a California Health Plus center. It's that easy. So we really encourage you, because through this PSA and the work we're doing with a world-class public relations firm, we are working to educate Californians about the unique and incredible services that you provide, the high-quality care that can be received at a California Health Plus center. Because community health centers are the place to get enrolled and the place to get health care services. Now, CPCA put a significant investment into this California Health Plus brand, but I want to make sure you know it is available at no cost to you. Now, certainly you have to do something. You want to get the brand out there. We want to get it on your health center, and we are also providing a lot of free materials to help you do that. So there is a commitment at your own part to get this brand into your materials, into your health center. But ultimately, all the extra support that we are providing, there's tremendous resources available to California Health Plus centers. And one of the most important one is in our Find Your Clinic component of our website, our California Health Plus website. Those centers that are actually California Health Plus centers are going to come up as the priority clinic to refer patients to when they're looking for a health center in their neighborhood. So again, we really encourage you to become part of this family. And the reason why California Health Plus is so important, I will tell you, I truly believe that this brand, California Health Plus, is our future. This is where community health centers are going. I know we're really proud of the history you have of being so well known in your community, so well known in your neighborhood. California Health Plus will propel you to be well known at a statewide level as part of a network of community health service centers serving over 5 million patients. We asked patients. We asked your current patients. We asked prospective patients. We had focus groups throughout the state. What is it that matters about the community health centers? Well, certainly, it was the way you treat your patients. Your current patients appreciate you. They value the fact that you will serve their entire family. They value the fact that you will serve them regardless of their language or their income or their status. They really value the quality care that you provide. But those who didn't know the health centers, they weren't so sure. But when they found out that the community health center was actually part of a statewide network of health centers, 900 strong, serving 5 million patients, that really made people interested and indicating that would be a place where they would want to get their care. And so again, that goes to the California Health Plus brand, which is pulling you all together to go beyond that neighborhood clinic and to actually become part of that statewide network and vision that we have. So again, I truly believe that this is our future, and what we have found through this association and almost a 20-year track record of success is that through unity, we are the strongest. By all coming together is how we have truly had the strength here in Sacramento and with our partner, NAC, at the federal level. And I think California Health Plus is going to take it beyond the advocacy. I mean, CPCA has been about the advocacy. We will continue to be. We're always going to do that for you. But California Health Plus is about what you do, those incredible services that you provide in the community, and putting that on the map at a statewide level. That's really where we're going with this. So I really want to encourage you to get on the brand as soon as possible. Val Sheehan and other staff at CPCA are around and available to help you if you want to talk about it while you're here. Again, please stop by the booth because I really do believe this is our future, and we want all of you to come along with this as one family, and I think it's going to truly be our success. And that's because this is our time. This is our time to shine. And I know there's struggles out there. I know it's not easy, but I do see you shining. And truly, the future is ours to craft. It's going to be challenging, but together, the community clinics and health centers of California are going to continue to lead the way, blaze that path forward. Working together, unified in our mission, there's really no obstacle we can't overcome. I think the history of the health centers in this state has shown that tremendous resilience over many, many years. And now this is truly our time. And there's so many opportunities out there, and I just want you to know that this association is dedicated to helping you become as successful as we can possibly be in this incredible environment of healthcare reform. The future is in our hands. Thank you so much. So now it is my pleasure to introduce the facilitator for